Thank you for joining us today. I'm Charity Menefee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Today, our moment of gratitude is dedicated to all of those who are working behind the scenes to protect public health. This includes all the lab technicians and staff out there who are working to process thousands of lab results they receive as quickly as they can, the drivers and delivery teams who securely ship the samples where they need to go, the many data entry teams, those who are manufacturing testing kits and supplies. While these exceptional folks may never have direct contact with the public, they are crucial in combating this virus. We know everyone is eager to learn about our local plan for reopening. Knox County Mayor Glenn Jacobs and City of Knoxville Mayor India Kincannon are working together in collaboration with us, members of the business community, and many other dedicated experts to release a phased reopening plan for the community. An announcement will be coming from the mayors about our plan later today. We will be offering another free testing event tomorrow at the Coliseum, located at 500 Howard Baker Jr. Avenue from 10 a.m. to 2 p.m. We're excited to be going back to East Knoxville, as our first event was in partnership with Kroger at Zoo Knoxville. While testing this Saturday is open to all, we encourage those who are not feeling well and who have had close contact with a confirmed case to come get tested. The public can drive through and walk up to get tested. Appointments will not be required. Everyone who gets a test will need to self-isolate until the results come back. And that can be longer if you're positive or if you're a contact, and our staff will inform you of that if needed. To date, it's taking approximately 4 to 5 days for results to come back from the lab. We do expect there to be long lines, so we encourage the public to be patient for this event. Next week, our testing will be conducted on Tuesday, Wednesday, and Thursday by appointment. Community members may schedule an appointment by calling our public information line at 865-215-5555. Priority will be given to those with COVID-19 symptoms, close contacts of confirmed cases, healthcare workers, and those at high risk of complications from COVID-19. In addition, we encourage the public, as always, to reach out to your primary care provider first, as a full health assessment is ideal. There are also multiple urgent care and walk-in clinics providing testing, which we do have listed on our website. The public can access the list of providers by calling our public information line that I just provided. And there are also multiple testing opportunities in the region that the public can access on the Tennessee Department of Health website moving forward and this weekend. 2 of those for the weekend are the following. Tomorrow, they're offering testing at Walters State Community College in White Pine from 9 a.m. to 4 p.m. And on Sunday, April 26th, at Rome State Community College in Oak Ridge from 9 a.m. to 4 p.m. And again, all of the details and information for that are on Tennessee Department of Health's website. Now we move to the local situation. We have 207 confirmed cases of COVID-19 in Knox County. You'll notice that's just one in addition to what we had yesterday. We did have a few cases come into our jurisdiction in addition to that, but we transferred some out. So the net change results in 207 cases at this time. 179 of those cases have recovered. Currently, there are 6 Knox County residents that are hospitalized. And we are pleased to report we have no additional deaths due to COVID-19 complications. As we stated, we continue to work to add more information to our local situation to our website to help inform the public. Today, we added hospitalization and death rates by race and ethnicity. Since the numbers are small, we encourage the community to use caution when drawing conclusions about the data that we have available. That said, there is a long history of inequities seen in virtually every other illness, whether it's cancer, asthma, diabetes, heart disease, and so on. So while we're not surprised that we're seeing disparities locally that reflect national trends in our COVID data, it's still heartbreaking. Your zip code, your income, your education, or race shouldn't affect your health, but we know it does. The root causes are complex, and we recently created and shared on social media a video to help explain what we call the social determinants or drivers of health. While much more needs to be done across our community and nation to ensure everyone has equal opportunity to be healthy, one positive in this pandemic that it shined an important spotlight on the larger public health issue of health inequities. This is an issue that will take all of us working together to address. Now to switch gears just a little bit, we've recently been made aware of a phone scam that is impersonating the health department in order to get people's personal health or personal information. This number shows up on phones as the Knox County Health Department. Calls from us do not appear that way. They do not have that listed. We have reported this activity. If you have any concerns that the person on the other end of the phone line is not who they say they are, please hang up and call our public information line number at 865-215-5555. We'll now open it up for questions.
All right, so if the media on the call will please place your questions in the chat box, we'll get started answering. All right, and our first question is from WVLT. The chief of the Centers for Disease Control and Prevention, Robert Redfield, said a second wave of the coronavirus is expected later this year. Is there any research indicating a second wave of COVID-19? And then there's a second part, what could influence whether this happens or not? And the third part, how is the county preparing? I can separate that out again if you'd like.
I might need you to. In general, and I think we've talked about this a little bit before, with the history of pandemics and the way diseases move throughout the world, there are commonly waves of illness. So hearing that there's expectations of another wave at some point later on is not unexpected. We absolutely are planning for that and considering that as we are working on how we expand our efforts moving forward. But it's not something that's unexpected. I think the time of when that second wave might be is a little bit up in the air. I've seen different things, but we absolutely do expect another wave at some point.
I think you answered all of that, but with the exception of maybe what could influence whether this happens or not.
Well, I think it really is, there's a lot of variables. There's not a single variable. So it's activity in the population and how many folks are moving around and how we're interacting with each other, the duration of the illness. There's a lot of different things that play into that. But again, we do expect there to be ebbs and flows and second waves moving forward.
Okay, and this one is, David, let me back up. David, if that didn't answer your question, please reiterate what you'd like us to address in the chat box. WATE has asked, I know you said the mayors will talk about economic recovery later today, but what data specifically does the health department look at to decide to reopen?
So the things that we've been talking about, we're looking at and making recommendations to leadership based on a lot of different information. So what our cases look like and how much they're growing each day is one of those factors that we look at. We're going to be looking at data about hospitalizations and what our hospital capacity is and all of those things moving forward. We've given them time to prepare and get supplies and do a lot of good things that have happened. So that's really put us in a good position there. Deaths will play a role in that, that we'll be looking at moving forward. And then how we're able to expand our efforts and what we're doing with public health and public contact tracing and case investigations and monitoring. All of that data plays a role in making decisions moving forward from the public health perspective.
From WBIR, you said this week you were following the state's guidance on when to reopen. They're clearing the way for the 89 counties to start Monday. Is that still your position?
I think that what we're going to do is wait and see what the mayors tell us this afternoon when we move forward. We've been having lots of meetings and doing a lot of work with our partners to prepare our plan moving forward. I think the most important thing right now, while we wait on the details to come, is to know that it's a phased reopening. where we're wanting to make sure that everything we're doing is to ensure that people can be safe while we do it. So all of those things we've been talking about for social distancing, making sure you're staying away from people, that you're wearing a mask when you're out in public, that you're washing your hands frequently, you're not going out when you're sick. All of those things we want to make sure are available and continue as we move forward through this phased approach. And really the personal individual responsibility there to do all those things is important.
Okay, we have another one from Channel 8, WBLT. Several health facilities have expressed concern that fewer people are going to hospitals and they're trying to ride out very dangerous illnesses. Are emergency rooms seeing fewer patients needing to be admitted to the hospital?
Are they seeing fewer patients?
Yes, are
Okay.
emergency rooms seeing fewer patients? Yes.
So that is something that we want to make sure that people know, that the hospitals are a safe place to go. They have plans and protective measures in place to help protect their staff and patients that are coming in. We don't want people who need hospital care to avoid going to the hospital. That is very important that people seek care when they need it. Is their census down? Yes. Are fewer people seeking, or do they have fewer people in the hospitals right now? Absolutely, yes. So we do want to encourage people, if you need care, if you need an emergency medical treatment, please go to the hospital. It's a safe place to go and they have capacity to take you.
Okay. From WATE, has the number of calls from the public into the health department decreased at all or increased? And what are people still calling about?
They're going up and down, really. So we had a few days that they were down. They've been back up over 200 calls the past couple of days each day. And it varies. It's kind of goes with what people are seeing on the news a lot. So we're seeing a lot of questions about reopening right now. We see a lot of questions about who can get tested and where they can get tested. It really, it kind of flows with what the news cycle says in a lot of ways. But in the numbers just vary they go up and down. Probably a pretty steady average when you average it out, though.
All right, one more from WBIR. From a health perspective, should people go eat at restaurants next week, even if Knox County decides otherwise? It's a 10-minute drive to another county. And then the second part, if so, is it safe to do so with people outside of your household?
So I think all of the things that we've been saying are still in play here. And there's those personal decisions that people will need to make based on what they feel is safe for them and their family members, because there's a lot of things that you need to consider. Are you or your family members at high risk for complications of COVID? If you are, you probably want to stay in longer. There's a lot of different things there, but we want to make sure that what we do is we do it safe. So if you do go out to a neighboring county or anywhere when businesses start opening, still follow all that guidance I just talked about. All of the social distancing things to help keep you safe is what's going to be most important at this time.
Okay, from WVLT, when will it be safe for visitation restrictions to be lifted from hospitals and nursing homes?
I think that it's probably two things, and we'll talk about those separately a little bit. The nursing home piece, that's our most vulnerable, highest risk population. We've seen a lot of negative consequences that can come when disease gets into that population. So just being straightforward, that's probably going to be one of the later places that you see visitation restrictions lifted, just to protect that population. And it's very, very important to do so because of the risk factors there. With hospitals, they're developing a plan right now moving forward as we're moving into reopening things, and the visitor restrictions on that will be coming forward as well. But again, want to make sure we're protecting. There's still vulnerable people in the hospital. So if things change, you still want to make sure you're wearing a mask if you go. You wash your hands frequently if you're in the hospital. That if you're sick, you don't go to the hospital unless you're going to seek care for yourself. You don't go visit someone while you're sick.
Okay, from WATE. Will the health department help local businesses find certain PPE to reopen, such as masks or gloves?
You know, we understand the concern there, and we know that that's what's going to be needed to help ensure people feel safe, that their staff feel safe. We can't help to provide PPE for everybody. We encourage you to look into your own supply chains. If there are concerns, you can report those. to our call line, and we'll follow up as we can, but it's not something that we'll be able to secure for every business in the community.
And from WVIR, are temperature checks effective? And should those be a mandatory part of any reopening plans?
I think temperature checks can be a tool. And so we use those in a lot of ways. We use them, other folks use them to have a gauge on if somebody might be symptomatic with COVID before they enter a facility or a business, something along those lines. That is one tool, and that does not negate all of the other things that you need to be doing to protect yourself, your clients, and the community in general. So again, the wearing the mask is a good idea that's recommended right now when you're going out, and all of the other things we've been talking about, washing your hands, not going out when you're sick, staying 6 feet away from each other, all of those things. The temperature check is just another piece of information that helps guide processes.
From WVLT, as restaurants and stores open, is it safe, is it safe for people to worship in church if they social distance and practice good hygiene?
So I think we'll see what the plans say as they come out from city and county mayor and from Governor Lee on people getting together. Right now, everything I'm seeing is still saying wanting to keep it to groups of 10 or less when you're congregating, because again, it's very important to keep people apart. So we need to be able to do that safely. On the church side, it's been really interesting and really encouraging to see all the other ways that they are serving their community, whether it's online services, or I think there's been some drive-in type services, which I think are fabulous. All of those things, we need to consider continuing to use those to protect the public.
Okay, from WVIR. Okay, I know you said the mayors will announce the plan later today. Do we have a timeline on that? Also, will we have a chance to ask more questions about that when they do?
I don't have the timeline right now. There's a lot of people, and there have been a lot of meetings today to discuss this and get the information ready. And I will have to see how they roll out their information later today, and I don't know the exact time.
From WATE, when can the county expect to allow elective surgeries?
Again, there's a plan in place that the hospitals have put together on this, and they're working with all of the hospital systems are working together on that plan. And my understanding is there will be an announcement about that plan early next week to provide more information on that.
Okay, if there are any more questions from the media, please put those in the chat box. Okay, well, thank you all very much.
Thank you.
And we'll talk to you again on Monday.